Welcome to the Healing Grove podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. So welcome everyone to the Healing Grove podcast. My guest today, Dr. Dietrich Klinghardt, has been on our podcast before, but I have the delight to bring him back to you and dive into a topic that I think is going to be really useful for people considering using ART and using his services. So we're going to get right into it after a quick intro. So for those who didn't see the last one, this is Dr. Dietrich Klinghardt. He studied medicine and psychology in Freiburg, Germany, completing his PhD on the involvement of the autonomic nervous system in autoimmune disorders, which if you look now at all the things that are cropping up in the world around brain training and brain healing and limbic retraining, and the impacts a brain health focus has on autoimmune system, you realize that he was really kind of the OG in this field. Early in his career, he became interested in the sequelae of chronic toxicity, including lead, mercury, environmental pollutants, and electromagnetic fields on the course of illness. And internationally, he's recognized for his successful treatment of chronic Lyme, chronic pain, autism, fibromyalgia, all those sort of mystery illnesses that Western medicine has a really hard time wrangling with. And of course, that's how I found my way to Dietrich Klinghardt work and actually trained with him back, I guess maybe 12 years ago now, and have been just a follower ever since, because you are always dropping pearls of wisdom and sharing so generously with the world what you learn in the clinic every day. His autonomic response testing in particular is taught to practitioners all over the world, including me, and about 1,200 other people who are now using this technique effectively to help their patients who are suffering with these sometimes very mysterious and intractable illnesses. It's the foundation of diagnosis and treatment in his Seattle-based Sophia Health Institute. And what I really wanted to do today was invite you to kind of walk us through what that clinic is like, what it does, what people can expect there, because I think for a lot of people who haven't learned ART, it can be very kind of somewhat mystifying. And so I wanted to demystify the process today. And then, of course, for practitioners listening, if you're interested in learning more about ART, we would direct you to all the resources and educational materials at the Klinghardt Institute. And we'll have links for all that after the podcast is released. So Dietrich Klinghardt, welcome back to the Healing Grove podcast. Thanks for being here.
Thank you, Kristin. It's a pleasure to be here.
Thank you. So we had talked about, it might be fun to explore what the experience is for a patient coming to the Sophia Health Institute. But first, I would invite you maybe to give us some background, like where did this clinic come from? How did you conceptualize it? And tell us a little bit about the birth of Sophia.
Yeah. So, the background very briefly, I did my PhD study on the autonomic nervous system and how it relates to vascular diseases. And then doing my research is for 3 years in the lab and working with patients, we discovered that most autoimmune diseases were caused by chronic infections that were hard to diagnose. And so I simply went to work and decided to develop a technique, an extension of the physical exam that will allow us to see what these infections are without having to do biopsies and sophisticated lab analysis. And with this in my back, I moved to America over 40 years ago and have been practicing ever since there. And then watched the rise of chronic inflammatory illnesses and watched the rise of autoimmune diseases, watched the increased cancer rates, and realized with my technique that basically most modern illnesses, the mystery illnesses, as you call them, like autism and Lyme disease and long COVID, are caused by persistent chronic infections, not the aftermath of infections like it's portrayed in some medical media, where something is damaged in the system and then you have the damage forever, but that most of these illnesses are ongoing fires burning in the patient. And so, and of course, my peers who rely on lab work, I was instrumental, when Igenex was at its birthplace, and with the owner then, he was a student of our work, and he realized that the lab methods were way behind the detection rate of real illnesses out there, including parasites and Lyme disease, the different aspects of it, Bartonella, Babesia, Rickettsia, and the same was true with long COVID. Long COVID is an ongoing chronic infection of a virus. It's not like the aftermath of a thing, but it's ongoing chronic infection. And of course, with COVID, we enter a whole other field where the RNA from the virus and from the vaccines is integrated into our own DNA by activating an enzyme called reverse transcriptase. So, so there is a new aspects to it, which is really the aspect of retroviral illness. That we learned a lot from HIV about retroviruses, but there's many others that cause milder illness, but still chronic illness. So, and then through our process of not being dependent on the lab work, we went on to see, well, why do people have these chronic infections? And realized very quickly that the background of why these things are growing had to be environmental. And so we watched the rise in aluminum toxicity of the brain and people. We watched the rise of lead toxicity, the aftermath of the leaded gasoline of 60 years of spewing lead all over the field. And we watched the aftermath of the mercury amalgam fillings, how they slowly poisoned the brain. And that was the contamination of our matrix, also including, of course, glyphosate and other farming chemicals, was the foundation of creating a growth medium for these infections, for these mostly pathogens. It didn't facilitate the growth of bugs that we need. Like we know with bifidus, for example, that COVID was devastating on bifidus, sort of that destroyed healthy bugs in our gut microbiome. And so we were able, with our technique, to discover the toxins before there were adequate tests available for things. And still, aluminum toxicity in the brain, you can only diagnose post-mortem, like Chris Exley did in England. And so we call our diagnosis a pre-mortem tissue biopsy. Sort of, that's a non-invasive pre-mortem tissue biopsy where we can look deeply into the tissues and find out who is there and what is there. And then complicating in the last 20 years is the Wi-Fi environment, sort of, which has been absolutely destructive to our intracellular milieu. And so, and that contribution of in the US, the fluoridation of the drinking water, the aluminum in the vaccines and the mercury in the vaccines and the aluminum that's sprayed on the sky and that we're inhaling. So the combination of toxicity and electrosmog has been the most important new thing in our world that is explaining the incredible rise in chronic illnesses. And so basically, I wanted to create a clinic that has gifted practitioners working with me that use ART the same way that I do, that can very quickly diagnose a patient in regards of the toxins that are present in the body, And in regards to the infections that are present in the body, we use actually a test that was developed by Dr. Yoshiaki Omura of New York. He is a practitioner there who developed the bidigital O-ring test, which got close to the same findings that we got, and that's how I met Dr. Omura, by guiding, and he's published over 200 studies regarding manual muscle testing, peer-reviewed studies that were published in different journals. And so we right now we consider our method evidence-based. We have 7 studies so far in PubMed on ART specifically. And so we're on good, solid standing with that. And so when I created the Sophia Health Institute, which was about 14 years ago, I wanted to surround myself with practitioners who have learned the technique, which is a bit of a learning curve. It's not a thing you do a weekend course and you can do it. It will take some time of practicing it and taking various courses, but also learning the theoretical backdrop. Basically my thesis is pretty simple. Where medicine has stopped right now is that most chronic illnesses are a sign of chronic inflammation. And Klinghardt's hypothesis is that all chronic inflammation is chronic infection. And that, of course, requires lab work that is not available yet, especially when it comes down to toxin levels in the system. And so I surrounded myself with practitioners who are willing to learn the technique and to apply it properly. And so we created the Sophia Health Institute that is representing that. And so when patients come to us, in general, our average practitioner, last time we took a count, this is now 6 or 7 years ago, the average patient has seen 32 other medical institutions or medical doctors before us. And so we're basically selecting the how to treat cases. And of course, they're only hard to treat when you're looking at all the wrong things. So if you want to treat a fracture by giving intravenous vitamin C, well, it's probably not an appropriate treatment for a fracture. You need to reset the bones and you need to put a cast on. And in medicine, if you look at mast cell activation syndrome, you find all sorts of things that you need to give the patient to calm down the mast cells, rather than looking at what is upsetting the mast cells that is causing it. And that's typically, we find the backdrop, there's a chronic infection, and there is viruses and retroviruses, and there is a whole bunch of toxins involved. And so ART is very quick. Within an hour, we can sift through a whole number of issues and put the patients on appropriate treatment protocols. And again, like when it comes to treatment, by having our focus away from the superficially treating the chronic inflammation, by actually treating the chronic infections, with our technique, we can very quickly determine what works better. Is it a cocktail of different herbs, liposomal herbs, nanonized herbs, or is it medical drugs? And so my ambition was, from many years ago, I worked with a shaman, and he inserted the idea in me that every time I write a prescription, I connect the patient with the most evil industry on the planet, which comes in names like Pfizer and others. And not only that, but also connect myself with that. And there is a spirit that descends on me that is negative and destructive and against health. And so I I had the ambition, of developing biological protocols for pretty much every chronic illness that we have. And so just to break that down, so with Lyme disease, we have it's called the Lyme cocktail. I work together in the US. The company is called biopureus.com. And we develop a cocktail for chronic or long COVID, that's Vital 9, it's called. And we developed a cocktail to detox aluminum called Allutox. And we were thrilled that about a year ago, there was a publication on how to decontaminate the body from the spike protein. And what emerged, amongst other things, was chlorella, the algae chlorella, which I've been teaching for 40 years as an ideal tool that provides you with certain nutrients, but also takes out of your body a number of toxic substances. And that emerged in the literature as one of the most potent things to bind and extract from the body the spike protein. So, and with chlorella, again, there is chlorella that comes quite contaminated. There is low quality chlorellas and there is high quality chlorella. And so we do the specs every 3 months on making sure that the chlorella that BioPure sells is the cleanest on the market. And so we're doing that. So of course there's many other things, but basically when people come to Sophia, there is first I see one of my practitioners that have trained with me for a couple of years, and the practitioner takes the entire history of the patient and reviews the lab work that's available and highlights the things that are significant. And then the patient comes to me for an hour, and then it only takes them 5 minutes to review the review.
Mm-hmm.
and guides me in terms of what we're looking for. We find a lot of untreated parasites in people. We find a lot of undertreated Lyme disease. We find a lot of course, a lot of chronic viral infection. But on a deeper level, many people now have chronic retroviral activity, which is really immobilizing the immune system. The current tests of the immune system may show it's all there, your IgG, your IgM, all that may be there, but are the white blood cells that are in charge of dealing with infection, are they active or not? And so our system gives us that. And so we, on the very first round of testing, I test people for toxins, I test them for pathogens. And so there's other aspects of it. We have a test that discloses if people sleep on a poor sleeping location, called geopathic stress. We have a very specific, very effective test for that. We have a test for extensive microwave exposure, from the cell phone radiation. And so we do that all in one session. And so rather than in functional medicine, we're looking at the outcome of all this without looking at the cause of it. So in functional medicine, we look at, well, your vitamin status, your mineral status, and we realized very quickly that all that is secondary to the deeper layer of pathogens that have taken over the system. And so rather than treating the results of the chronic infection, which is beautifully done in functional medicine, we're looking at the underlying causes, and we're very good at that. And that's why I ended up, with we have an endless number of autistic kids, and can't accommodate all of them, but we do as much of it as we can. And we have a lot of people, well, the usual things, the chronic fatigue and the chronic pain syndromes and the occasionally I'm always thrilled if I see a patient who's simply got a bad shoulder or a bad knee or a bad neck. That's for me the thrill when I actually get something that's localized in one area and deal with that, because that often can be sorted out in one session.
Yeah,
But,
yeah, that must be a nice break in your day. When you're like, actually, you just have a rotator cuff. I wonder if you could just to put a point on things. So I'm listening sort of through the perspective of maybe someone who's never experienced muscle testing of any kind, or ART for that matter, which is probably the best and most effective form of applied kinesiology. And I think when people hear you say we have tests for this, tests for that, the answer is always ART. You're not sending people off to different labs, right? You're using the system you've developed to kind of query their system to find out whether the list you have that you're bringing to the conversation is an issue for them. So I like to explain to people, it's like kind of like 20 questions for the body, but your questions are what informs the direction. And it's really about how good of a question are you asking?
Exactly. And the thing is, with the limit of my test is that we need a biological sample. I need a culture of Borrelia, I need a culture of Babesia, I need a culture of retroviruses. And you give me the right culture of a bug, I can find it if it's in you.
So
You
for
give
people listening, that means you have a slide on which you have a sample, actual sample of Borrelia or Babesia or Bartonella. And that is sort of the basis of the question energetically that you're asking the patient.
Exactly. And I can only ask the questions if I have a sample of that represents that in the physical body. So that's the limit of my test. Of course, we can obtain samples of that at the different biological institutes, which is not difficult, but things I haven't thought about. Of course, we don't test for.
Right. You don't know the question, you can't ask it.
Yeah, exactly. And so, however, the if a patient has seen 32 other doctors, some of them, of course, that's average. So some of them have seen 60 or 80, and I know what's left to look at, which is, the parasites and the infections, basically, because there is no good lab work for that. For the infections, yes, we can test for strep and we can test for staph, and we can test pretty well now for Borrelia and Babesia, but there's a lot of other infections that we have no real good test for. For example, I mean, I'll just give an example. We find a lot of people that have sciatica, right, as one of the many symptoms that they come in with, or facial pain. And it's in the literature, but completely overlooked that very frequently these severe pain syndromes are caused by herpes zoster. Now, if you do the general lab test for herpes zoster, yes, you find it positive, but does it mean that your sciatica is caused by herpes type zoster? So that's and so with our technique we can specifically localize, or if your right knee pain is caused by Bartonella, I can make a general test for Bartonella and may find it positive, but it doesn't tell me that knee pain is caused by Bartonella, and it will respond beautifully to ozone injections.
So again, it gets back to the precision and accuracy of your question and the lengths to which you're willing to continue asking questions until you find the root. I wonder if you could kind of paint a picture of what it looks like if we were a fly on the wall in the Sophia Institute watching a patient's first experience with ART and you or one of your team. What would that look like?
Yeah, so the first visit with my practitioner is simply sitting on a desk and then doing a normal physical exam, taking the blood pressure, the heart rate, the oxygen levels in the system, and then doing a physical inspection, of the skin, make sure there is no skin cancer somewhere where the patient can't look, and palpating the belly, listening to the heart. So that's all done in the first visit. but no ART usually done. And then the patient comes to me, just a room across, and then I talk to the patient briefly and look for hints, of what may be like, for example, I ask more specifically how the patient was born, if they were vaccinated as a child or not. I may ask questions, do you have a history of amalgam fillings? Do you have root-filled teeth? What's your dental status? So I may just quickly ask a few extra questions that may have been not possible at the time of the first visit. And then the patient lies down on the treatment table. And then I work with indirect testing that's called, that was developed by Dr. Omura. He shows when you put a healthy person between the person doing the arm testing and the patient, so the in-between person, we call that, yes, usually one of my female assistants, touches the patient. Well, there's an exception, is our male Orthodox Jews, which are not allowed to be touched by women. So we figured out a way of how to do that without touching the patient. And then the in-between person, I test their arm or their O-ring. And so I do the muscle testing of an in-between person, but I'm provoking the organs of the patient, for example. So I'm not only touching the belly, but I'm deeply sort of palpating it in different places to look for trouble. I may compress the heart. I may have them take a deep breath and hold it to test the lung. I may squeeze the thyroid gland to see if there's any stress that occurs. So basically, we're looking for stress responses in the system. So the system can give us three things. It can give us a stress response. It can give us a healing response also, which we can differentiate. So I may put some vitamin C. No, we don't work with putting things on the patient. We use an in-between gadget called the signal enhancer. I think that goes too far to explain that, but we use some sophisticated tools from light physics, from biophoton physics, which I had a fantastic mentor for, Dr. Fritz Albert Popp, when he was alive. He was for many years my mentor in biophysics. And so basically I'm stressing organs in the patient, including the brain, by compressing the skull slightly. And then any infection that's in the patient becomes immediately visible. And we find very often, well, the most common overlooked thing is people that have been treated for Lyme disease, for years with antibiotics, come to me, they still have the fatigue, and they still have their depression and their limbic system symptoms, their anxiety. And then we have a test for the limbic system. And if I stress that, and then it tests against the culture of Borrelia, well, I know that deep in the brain is still a nest of Borrelia in spite of the antibiotic treatment they had. And then to cross the blood-brain barrier with medicine and to accumulate enough medicine in the limbic system is a whole art, how to do that. And so that's why I developed these different herbal cocktails. They all have to be liposomal, they all have to be nanonized. And that's why I decided, I have to work with one company, in England or in the English-speaking countries of the world is Key Science, KI Science, and in the German-speaking countries, it's also BioPure, but that's an Austrian satellite of it. And so basically, I can say this, the most overlooked issue in patients is parasites. and the depth of how COVID and Lyme disease have invaded the limbic system and are causing really a kind of madness in the entire population. And since, we, after reading the book from Chris Newby, who wrote a beautiful book on Lyme disease, basically being investigative reporter, she tracks the history of modern Lyme disease, and basically it's not just COVID, but Lyme is also a man-made composition of different bugs that's designed for deep penetration into our system. And with ART, we can look in the brain and actually see that what's driving them is not a deficiency of psychiatric drugs. That's how it's treated in medicine. Your anxiety or your insomnia, that's a deficiency of certain pharmaceuticals. Well, it's not. So it's driven by chronic infections. Of course, the viruses are involved, Epstein-Barr and typical fatiguing viruses, herpes type 6, and so on and so forth. But with our technique, it's become very simple and very, the flow of our exam sort of reveals all that. And then it's time for treatment, and so in the same 1-hour session, I also establish a treatment protocol for the patient. And we have a way of prioritizing all the different issues, because we know that pretty much all of us have all of it. Most of us have lead toxicity, at least the ones born before 1980. All of us have aluminum toxicity in the brain. All of us who live in America are glyphosate toxic. And so that we establish a quick protocol for that, because we find it in pretty much everybody. And so there's sort of a standard that we have, to reduce the foundation of the growth of pathogens, other contaminants in our system. We reduce the Wi-Fi environment, with some of the very commonly known protective measures. People have to shut off the Wi-Fi router at home. They have to reduce the use of the cell phone. These are all important, but also we give them protective clothing, protective blankets, and we give them internal protection with different antioxidants. So our space have been specifically shown to work for that. The ginkgo biloba and propolis. Propolis is not exactly an herb, but propolis is very potent, and then rosemary tincture. And so we put that all together. And so we address that on the first visit, and then we look at the infections. And usually there is a hierarchy amongst the bugs in us, where very frequently behind the Lyme and the persistence of the bugs are retroviral infections, which sometimes we can do an interview on that to teach people of what that is and how to deal with it. But it has been a huge discovery. I'm thanking Judy Mikovits, who's been sort of my mentor in that. And so we had a think tank, like in the early part of this century in California, where we met twice a year for a week, some of the leading scientists. And I was sort of like a side note there. But I was one of the very few people who was actually seeing patients who could translate the knowledge gained there into action. And so so on the first visit, people usually end up with a protocol for detoxing, for dealing with the electrosmog, also for improving the sleeping location in the house that they have. And also, then usually on the first visit, I don't deal with their psychology yet. There's exceptions to that, if a test is a priority, but then we have a test of underlying all of the infections and the toxins also are some significant psychospiritual issues that unless you address these, the patient will never get well. And so that's sort of the other part of treatment modality. I studied psychology after medical school, and for 3 years. So yeah, it's limited, but I did study that. And so we developed a treatment called mental field therapy that very quickly goes very, very deep into the psychology of the patient. And because of the nature of the technique, it doesn't stop with the birth of the patient, but we often find also problems that happen in the womb or problems that happened before we were conceived. Mostly stuff from the family history. Sometimes there's karmic issues, and increasingly often we also find more severe spiritual issues. People are invaded on a psychic level by forces outside the known family and the known immediate environment. But that's again something probably not appropriate to discuss here. But the technique is leading us very deep into the real underlying causes. And there's certainly, I think I can say that there has been a darkening of the psychic field that surrounds us, of the greater psychic field. And there is an increasing, growing darkness. And of course, I'm a Christian, but we had this great leader in Christianity who didn't heal with herbs. He didn't heal with fixing the bite or removing teeth. He healed by, well, yes, had some presence about him, sort of, that was healing people, but he was also very strong in expelling demons from people. So for me, the funny thing is, there's so many Christians that I see that never heard about it. I never considered that. And it's sort of like, for me, always the thought was, well, now that we have airplanes and computers, does that mean those issues have gone away? Or is it just that they've been ignored? And so we've, unfortunately, I almost have to say, stumbled into that more and more, especially the vaccinated population, that there's been piggyback on the vaccines, has been some spiritual forces that are not good, and that need to be dealt with for people to get well. And so, and of course, then, 60% of my practice are now Orthodox Jews. And for them, it's, I have to send them to their own rabbi to deal with that. And so, depending on people's religion, I have to be respectful of that. It can get complicated to talk about issues beyond the physical body. But like I said, we don't do that on the first visit. This is when people
It's not for the first date.
No, not a first date conversation.
I'm really glad you brought up the Orthodox Jews and sending them to their own rabbi. And I wonder to what extent people's belief systems can impact their ability to receive and communicate during an ART session.
Yeah, so the basic thing is this, that if you have a treatment that is hitting the truth in people, then regardless of their beliefs, it works. If our treatment is slightly off or not effectively dealing with whatever we find, then the belief of the patient can be helpful in adding to the treatment result, that even an ineffective treatment can become effective through the patient believing in whatever they're doing. But my experience is, on the first visit, people that have seen 32 other practitioners come in with an expectation that this is another visit they're doing that's not going to work for them. And so people tend to come to me with a very, very distrusting of treatment results, very distrusting of the diagnostic process. And so that is of course an issue, but once the patients are on the table and I put them on a protocol, we do follow up with phone calls on the patient, and most people have a positive experience after the first visit that they did not have with 32 other practitioners. And so, and that of course builds a certain trust where they open up, first of all, to the more mundane psychological issues like their marriage or their childhood. But then as we're dealing with that, and we have a wonderful practitioner in the office, her name is Debbie, who does wonderful work on those levels. And then very often when we clean up some of their trauma history, we're approaching the deeper issues. I tend to do that with the family constellation work, where all my patients are invited to participate on that, which I do every time I'm in the office. Sort of we do the work. It's usually a Saturday that we do that at, and so people have a chance, if they're willing, to look deeper into this stuff. And so we accompany. Last time we talked about the 5 levels of healing. So we're dealing with the physical world stuff. We're dealing with their teeth. We're cleaning up the mouth, which is a big issue, even to find dentists. Now, every dentist calls themselves biological dentists, as a business model, but very few of them are. And so we have our few people in the country, in the US, but also in England, Australia, New Zealand, that do clean and good work on those levels. So on a physical level, we do that. We do good chiropractic and osteopathic care. And we deal mostly with biological agents like herbal cocktails for healing. We do some intravenous therapies, intravenous chelation therapy to more rapidly lower the toxic metal levels, and to also use more maybe less known things like the IV infusion of spermidine, which has been fantastic for COVID. For long COVID. It's a bioflavonoid extracted from a wheat germ oil. It doesn't have any gluten in it, so it's safe to use. And so we use usually during the first visit and second visit, we do a lot of intravenous therapies. We also do we have wonderful 2 shamans working with us who work on a massage license, but they do wonderful healing work on the other levels. We have an acupuncturist, we have colon hydrotherapy, which is important. One of the more important tools that we're using on many patients is the liver flush. So that's, I know in the naturopathic community, very well known, and everybody does that, but in people that have been through all the medical institutions, it's not unusual that none of them have ever heard what a liver flush is. And so we use some common sense things. We use also like general wonderful treatments like the Epsom salt bath. This Epsom salt is magnesium sulfate, and the focus was always on the magnesium, but actually it turns out that cholesterol sulfate is a hugely important healing molecule in us that has been overlooked. It's Stephanie Seneff's new work. And it is very difficult to get enough sulfate on board. This is not sulfite. This is not what you're allergic to. It's an essential molecule in our body. It's as essential as oxygen or water. And so you cannot be allergic to that. And so we found that the Epsom salt bath is a wonderful way of getting enough of that into the system without having to swallow it and have it been messed with the deficient microbiome in the gut, which is, I think one of the big overlooked things is that people think what they swallow is what it gets is the substance that they're actually getting. They forget that what you swallow first passes through the microbiome of your gut and gets altered by it, either in good ways or in bad ways, and then you absorb it, and there's the first pass to the liver, which may destroy all of it, and maybe let some of it go through, but maybe a changed molecule, and then by the time you get all the way to the mitochondria, you may deal with the very, very different compounds. And so the Epsom salt bath, as an example, is a way of bypassing the gut and the liver. And so you get much more efficient delivery of certain molecules by putting them on the skin or absorbing them through the skin. And so
I love that you've revived a lot of these of our great grandmother's tools. You know, the Epsom salts baths, the enemas, the liver flushes. These are castor oil packs, right? These are things that humans did for so long. And, you know, I have a lot of patients in England and they're not allowed to you can't buy an enema.
I know.
You have to go to the hospital and have some kind of doctor's order to let someone put some water in your bum to relieve constipation, you know, not to mention to treat your liver and all the other things.
I used to have a practice in England, you know, aside from my Sophia Health Institute, and the first patient I sent to a local pharmacy to get an enema set up. But the pharmacist said, "What's an enema?" The pharmacist, yeah.
Wow.
So there is cultural differences between the different countries.
Yeah.
And so then we have to be respectful of that, and also fortunate now through the internet, people can Google pretty much everything and find it in every country. But even 15 years ago, that was not common, not possible.
Yeah. Well, I mean, it's true. You can definitely watch videos of people getting enemas on YouTube, but what you can't do is get the kind of walkthrough of your process that we've gotten today. So I really just want to thank you for that. I think it's for a lot of people, especially people who know nothing about ART, know nothing about your work. It's been a really nice overview, and I think has hopefully demystified some things for people who might be interested in, or who might be one of those people who's been to, you know, 32 doctors and is ready for getting to the real root of things. So if somebody wanted to take a next step with you, how would they do that?
Yeah, so I mean, the simple thing is it's called Sophia Health Institute, and there is an email address and phone number, and so people can just register just very normally, and they may request a 15 or 30-minute consult first on the phone to see if they will be getting what they're hoping for. You know, so this through the website, you know, people find contact to me, and like I said, my waiting list may be a bit longer, but the practitioners that I've trained, and they're well trained and they're fantastic, you know, you can get in pretty quickly.
So that would probably be a question for people like you have trained personally, all of your practitioners and your team are all well versed in the same tools and the same mindset and understand the 5 levels of healing and the 7 factors and all of it.
Exactly. And quite honestly, Kristin, like what was important for me from the start, there's no point in me becoming a fantastic practitioner and then dying with that. I was kind of guided, you know, like all of us are, in a way that it was always important from the beginning to teach the tools, and the things that I developed, the techniques and things, need to be teachable, need to be reproducible, because if they're not, they're probably not objective. You know, they're imaginary and placebo effect based ones. I don't want to minimize the placebo effect, but there's many tools that are taught out there that have no biological foundation. And so it was important for me to also test my own methods and see if it's teachable and somebody else can do it, then it's probably real. You know, so that was my request to myself. And so, yes, I've trained a number of people, and a good lot is still with me. and doing exactly the same work.
Yeah.
It may, quite honestly, usually people request after seeing one of my practitioners 2 or 3 times, then they get a chance to see me, so quicker, so that's a fast way in. But either way works. People can see me directly. That will take a few months to get in, or they can work with one of my practitioners to get basic things out of the way, the parasites and the Lyme disease and the mercury toxicity, to have that addressed quickly before they see me. And then I obviously like to work, probably like you too, I like to work on the higher levels because I've become good at it, and there is not that many of us that work on that level.
Yeah.
There's, again, like on the higher levels, there's a lot of I don't want to be negative, but a lot of pseudo teachers, on the higher levels, and there's a dangerous ground to get on for patients. Can I trust the practitioner? Can I not trust them? If they're leading me somewhere, and so it's a delicate issue to work on the higher levels, of our existence and illness causing issues.
Yeah. So maybe that's, of course, we're going to share information on how to reach out to you at Sophia Health Institute. We'll share a link for practitioners who want to learn ART. But before we close, I'd sort of love to hear from you about how you stay really clean and really in the light as you do that work on the higher levels. Because you're right, it takes not just a special person, but a person who's committed to kind of integrity and that kind of energetic cleanliness.
Yeah, so I mean, to be honest, first of all, I'm not that good in taking care of myself, but you probably know that too. But I have my practitioners test me regularly. That's one thing, and I'm always looking for psychotherapists or psychic healers who work on higher levels, and I've gotten pretty good in finding the ones that actually are helpful to me. And so, but I spend a lot of money, just like many of us do, on my own therapy.
Mm-hmm.
Where I'm not good at is the food issues. So like where I live in outside Seattle, there's absolutely within miles, there is not a single store that sells organic food. There's not a single restaurant that offers organic food. And so I'm restricted in that way. And so I constantly have to adjust my own treatment protocol to accommodate that. To take the glyphosate on, we know now, is humic acid, which is pretty expensive. There's an extract of humus and peat extract, sort of, and to deal with the lack of minerals in the food, I take what I believe is a very good mineral supplement, and so on and so forth. So I look at all those issues. Some things are self-evident, and some things I let my practitioners test me for.
So what I'm hearing is you've really cultivated your own healing team to be able to work at the high level that you work at. Yeah. Awesome. That's a beautiful way to end, I think, and provides a public service announcement for everybody doing work, either on themselves or for their kid or for patients and clients. So thank you for that reminder.
Yeah, thanks, Kristin.
Yeah, this has been great. Appreciate you so much. Thanks again, Dietrich.
Yeah, thank you, Kristin.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.